hormonal changes
Mm.
can affect, can cause this premenstrual syndrome.
Mhm.
Everybody, but those who are susceptible for that, those whose hormones are imbalanced for them.
We really talks to a lot of women about their menstrual cycle, and you deal with it frequently. So I read in an article that there is early onset of menstruation seen in young girls, and there is early onset of what do you call this, menopause seen. Is that true? And why do you think that is?
Yes, it is true. Nowadays, we are seeing like girls are like menarches, they are attaining menarche in very early age, in before 10 years only, like 8 years, 9 years, 10 years only, because they are accumulating fat in their body. Yeah. So because of this insulin resistance only, accumulation of fat basically, that is causing early menarche.
Okay.
Most of these women are having this.
So does that mean that earlier, when menstruation starts earlier, does it correlate to early onset of menopause also, or is there no correlation?
So basically, menopause is the time when the eggs are used, okay, completely finished. Then it causes menopause. So early menarche definitely can cause early menopause. But nowadays, we are seeing like egg reserve is reducing because of unhealthy lifestyle also. We are seeing so many cases of low AMH in young women also. In 20s, 30s only, the AMH, which is an indicator of egg reserve, it is reduced. Yeah. So that is called premature menopause.
Premature menopause.
Premature ovarian failure, we say.
Okay. Is it true that women as young as 35 go through premature menopause, or even younger than that?
Yeah, that is happening. Yes. In 20s only. So I am so surprised and I was helpless what to do for them. They are unmarried and their AMH is 0.02. I cannot do anything for them.
So when an AMH level goes down, is there nothing that can be done for anyone?
Actually, nothing can be done. But there is an option like stem cell transplantation into the ovaries. And we can do that. But it's expensive, like it's an invasive procedure. Yeah, that is
afford it.
we cannot do.
So how does this impact fertility as a whole?
So yeah, basically female fertility is an indicator of female health.
Yes.
Okay.
Yes.
The natural menstrual cycle is also a vital sign of female health. Right. So we cannot take fertility as a separate thing. It is an overall health. Okay, to explain. So by optimizing our health by addressing the root causes, as I told, so anything like, for example, any stress, physical or mental, any stress causes shutdown of the reproductive system actually. Okay, like causing infertility.
Right.
So nowadays we are having physical stress like hormonal imbalance, metabolic disorders. Also, they act as kind of stress that is shutting down the reproductive function. Even emotional stress also. So just by addressing the root causes again, balancing hormones, by improving the metabolism, we can back up our fertility.
Right. Thank you so much. Ma'am, I also want to ask you how menstruation starts in the body, how it flows, what happens to the body, what happens to the physiology, if you could explain to us.
Sure. Again, I wanted to share my screen for that.
Yes, please. We have got the access.
Thank you. So basically, I will explain normal menstrual cycle and why these cysts are forming in the PCOS.
Okay, sure.
So first, normal menstrual cycle goes like this. Like this is a structure of our uterus. We all know, I think everybody knows the structure of uterus. This is uterus, this is cervix, this is vagina, these are ovaries, and these are tubes. And this is endometrium, lining of uterus, we say, right? This is endometrium. So this is represented here as right. This is, so I know analyzing and understanding graphs is difficult, but I will just try to explain it. So this is a number of days, day 1 to 28 here. So the from day 1 to 5, shedding of this endometrium takes place. So bleeding happens. Here, after this, gradually the endometrium starts increasing in the thickness. It increases, and by 28 days, it sheds again. Okay, so it happens so beautifully, so rhythmically every month. But this got disturbed. This is getting disturbed nowadays. But how this happens, I will explain. So how this is happening is under the influence of hormones. Obviously, we all know, under the influence of hormones. But what hormones? Which hormones? LH, FSH, estrogen, progesterone. So these hormones are basic and main hormones. Maybe other minor hormones and growth factors will be involved, but let us understand this first. So FSH and LH hormones are produced in our brain, in our pituitary gland. These hormones act on these follicles. Okay, these ovaries contain many such follicles. So I have represented only one follicle here. Follicle contains egg. Okay, follicle is nothing but a cyst. The inside of that contains egg. So as the follicle grows in size, as the number of days pass, what happens under the influence of hormone? This follicle grows in size and it secretes estrogen hormone. When the estrogen hormone levels peak, okay, a certain level it level reaches, it LH also peaks simultaneously. Then it triggers ovulation in the middle of the 14th day. This is the first half of the cycle. Then in the second half of the cycle, what happens? This remnant follicle called corpus luteum, it secretes progesterone hormone. In the first half of the cycle, estrogen is important. In the second half of the cycle, progesterone important. So this progesterone is increase in the blood, and as this corpus luteum, it does not stay for a long period of time. It regresses in the size. And when it regresses in the size, progesterone levels drop in the blood, and that causes shedding of the endometrium.
So basically, menstruation cycle is shedding of the endometrium.
Yes, yes.
Every month.
Yeah. So when this continues, when the size of the corpus luteum continues, pregnancy happens actually. Bleeding does not happen. We will miss the period. Okay, when fertilization takes place here, the corpus luteum maintains and bleeding does not happen. Okay. So usually we check ovulation with the LH kit because LH levels peak, and we will know if ovulation is happening or not with that LH kit. And sometimes many PCOS women, they don't get periods. No, they will be given progesterone supplements. As I told, progesterone levels will be high in the second half of the cycle. So progesterone supplements are there. They will give for a particular period of time and they stop. When they stop the tablet, they will get period in next 2 to 3 days.
I see. So it's like induced menstruation.
Yes. Inducement.
No.
So in what happens? Yeah, you ask your question.
No. I don't have any question. Please continue.
Okay. So in PCOS, what happens? This kind of rhythm is not in a proper way. Okay, this ups and downs of these hormones does not take place in a proper way. So LH hormone will be high in the beginning itself. So this that what happens? Estrogen levels also will not be in a proper way in PCOS women. So ovulation does not take place.
So the LH level, the estrogen level will not peak. It'll probably remain constant, or it'll peak in another time.
Yeah. So imbalances, that is what the imbalance is. Basically, when I explained the genetic cause, estrogen levels will be slightly less in PCOS, right? So also can be the reason for anovulation.
Awesome.
Yeah. So basically, every month, as I told, not only one follicle will develop, a group of follicles will develop. Out of only one becomes dominant. Okay, that will release the egg, and if it gets fertilized, women becomes pregnant. If two follicles will grow, twin pregnancy.
Okay. And the rest will be flushed out when the periods happen.
Yes, exactly. So this dominant follicle will send signals to other follicles to regress in the size.
This is so nice.
Yeah, so we will see only one follicle actually in a normal. But in PCOS, what happens? Dominant follicle is not formed because of the hormonal imbalance. So these remain like that only. Those cysts which are recruited, which are selected, they don't regress in the size and they remain like that only. And we will see as a cyst.
Oh.
Yeah. So by this, do you feel that laparoscopy works for this? Laparoscopy is a treatment just by puncturing these cysts. Would that be a permanent solution? No, right? We need to balance our.
Yes.
Yeah.
So your works better.
Yes. So to summarize, this is the peak happening LHFSH. Ovulation is happening. In PCOS, no peak, no ovulation.
Got it.
Okay. Yeah. The solution is not laparoscopy. Old way, laparoscopy is the old way. New way is natural hormonal balance.
The one that you're embracing and teaching every woman with PCOS.
Yes.
Awesome. Yeah. I have one more question that I came across recently. I've heard about premenstruation symptoms or premenstrual symptoms, but there was another thing that I heard, and it's called PMDD, premenstrual dysphoric disorder, and apparently it affects around 10% of women of all reproductive ages. What is this? How does it affect women?
Yes. So just now I have explained the progesterone levels in the second half of the cycle, right?
Right.
So hormonal changes can affect, can cause this premenstrual syndrome. Everybody, but those who are susceptible for that, those whose hormones are imbalanced for them. This is common. This can be mild or severe. Yes. So mild PMS, we say, that can be easily managed by simply adopting healthy lifestyle. PMDD is something which is a more severe form of PMS. We need to try, first of all, with strict lifestyle modifications, definitely.
Okay.
It is very severe, we can take help of allopathic medications, maybe like antidepressants or birth control pills. Of course, I don't give birth control pills. I never give, but that the treatment in allopathy actually.
Okay, standard treatment.
Standard treatment, the so-called.
Yeah. Because I was looking at the symptoms, and these are like very scary, and these can be easily confused with mental health disorder also.
Yes.
Or somebody going through PMDD might be easily mistaken for being a very, sorry, but bitchy woman. How how do we control that? How do we educate people?
So if you ask me, I will say only one solution. They need to figure out what's wrong with their lifestyle, first of all. First, calm down. What exactly is going wrong with their lifestyle? As I told, the root causes, mainly they should focus on their gut health. So optimization of their gut health will balance all their hormones. Then they can feel much better. And gut health is the food they eat, when they eat, the timings of the food, what they eat, when they eat, and exercises also impact our gut health.
Yes. And so when the lifestyle changes are made, the symptoms, the PMDD symptoms will also decrease?
Yes, of course. Yes.
Because I read, please continue.
They need to take supplements also. Sometimes what happens, vitamin deficiencies, they also aggravate these symptoms. So they need to take good vitamins and mineral supplements also, along with proper lifestyle changes.
I see. What kind of vitamins deficiency can affect this?
So basically, vitamin D, B12, iron, these are there, but some mineral deficiencies also, like magnesium, calcium, all these things they need to take care of.
So it's not so easily treatable, and it's not something to be taken lightly also.
Yeah. So we need to be like addressing all the root causes, including, like we cannot leave anything else. We need to treat it in a holistic way.
Correct. Very true. And that brings us right back to your favorite treatment option: holistic approach, natural method of treatment, best way of treatment.
Okay.
Okay, then. Well, that's wonderful. And this is how we're going to sign off with your treatment plan.
Yes.
All right, then. Thank you so much, ma'am.
Yeah, thank you so much, Jameer. Yeah.
You have a very good weekend.
Sure. Yeah, thank you. You too.
Bye-bye.
Bye.